You're listening to In Network, Nordic's podcast series where we explore healthcare and technology with experts from around the globe.
Hello, and welcome to the In Network podcast feature, Designing for Health. I'm Nordic's Chief Medical Officer, Dr. Craig Joseph. I recently sat down with Randolph Bias, founder and CUO at UXonSpec. We discussed his insights on the evolution of the field, the rise of design thinking, and why intuition alone falls short. We also discussed the critical role of user research and data in shaping effective design, and why investing in usability is essential for long-term success. Let's plug in. Welcome to the show, Dr. Bias. Where do we find you today?
Dr. Joseph, thank you so much for having me. I'm in my home office in Austin, Texas, where it's a balmy, 75 degrees, a little light rain. Happy to be here. Thank you so much.
I am excited to have you here. I always like to get the origin story for our guests. So let's just start all the way back to where you were born. No, we won't go that far back, but I think we can go back to you being a college student at Florida State.
We'll start maybe in the last day of junior year. I was a psychology major. I was getting kind of bored with college, didn't really know what I was going to do with a psychology degree. And the day before I went home for summer vacation, I learned that you could get in the honors program with a 3.2 grade point average, which I had, instead of what I had originally thought, a 3.5, which I did not have. My golf game was in pretty good shape back then, partially explaining that. Anyway, learning that I could get in the honors program, I thought, I'll do some research. Senior year, that'll be something fun. And so I had this one professor whom I loved, whom I had taken multiple classes from, and I filled out the application. I went to his office and he was gone. So I forged his name and submitted the application. And then the next day called him and he said, yeah, that's fine. And so I got to do some psycholinguistics research as a senior. Then somewhere in there, I figured, I guess I'm going to have to go to graduate school. So the University of Texas at Austin was the best grad school I got into. So Cheryl Bias and I moved to Austin, Texas, never having been west of Pensacola, Florida. And I got a PhD here in cognitive psychology, studying things like human perception, cognition, psycholinguistics, memory.
So you move from Florida to Texas and you get a PhD. And then what was your goal in getting a PhD?
More than anything in the world, I wanted to be an assistant professor teaching psychology somewhere, making $12,000 a year. And I failed either because I wasn't smart enough or the market was bad or some combination of that. And all my buddies started getting these high-powered jobs at Bell Labs and IBM. And one of them got me an interview at Bell Labs in New Jersey. And so they were selling themselves as, reasonably enough, human factors psychologists. And so I got hired for a lot more than $12,000 a year to go be a human factors professional at Bell Labs in New Jersey. We did that for 3 years and loved Bell Labs, didn't much like New Jersey. And so 3 years later, I got hired by IBM Austin to come back here, for which I've been eternally grateful, and spent I think like 12 years there. And then a business partner and I started Austin Usability in about 2000, a small usability lab and consultancy. Oh, there was another company in there, BMC Software, which I should have mentioned earlier. I was the first UX guy they hired, and I managed and built a small team in a lab. Then this business partner and I started Austin Usability, a small usability lab and consultancy. And so that covers 20 years of me as a practitioner, human factors, usability, UX practitioner and manager. Then in, I think, 2003, did I finally, and all along I'd been publishing a little bit. I still had this vision that maybe I'd become an academic someday. So by the time I got to apply for this job in 2003, this academic job, go to academia at age 50, my resume looked better than the average 20-year practitioner. And so I got hired and then spent 20 years in academia teaching grad students at the School of Information at the University of Texas. Whew.
That's a lot.
That was me quick.
That is a lot. All right, let me unpack some of that. So I am fascinated by Bell Labs. It is in New Jersey. And we can't deny that. But, it's kind of a storied place of a lot of people who just got paid to tinker and think, and often with no expectation that they would produce something valuable to a company or humanity, but they did. So what did they hire you? What were you supposed to be doing at Bell Labs? What were you doing?
Full disclosure, I was not at the think tank. I was in a dev site where we were developing software for the baby bells, Southwestern Bell, and it was big mainframe stuff. And I was doing usability, human factors stuff, but it was at a different level than now. We made little incremental changes. Here's the other thing I'll tell you about Bell Labs, and this is semi-rude, but you'll let me do it.
Oh, I like that.
The smartest people at Bell Labs and the smartest people at IBM are all just as smart. The dumbest people at Bell Labs are a lot smarter than the dumbest people at IBM. So the whole time I was at Bell Labs, I was kind of new to practice, to industry, but B, I felt like I was dancing as fast as I could to keep up. By the time I got to IBM, I had my feet under me maybe and was a little more confident, and period. We'll talk about the transition to usability later.
Okay. All right. So that's fair. So what were some of the things? So is it a similar thing at IBM where you were kind of working on making software more accessible to humans?
Yes, but so this is exactly where I was headed. I think it was probably the advent of the PC, whereby human factors kind of segued now into usability, where we're worried. I mean, human factors certainly is worried about human cognition, but now we're worried about every man, every woman, every person interacting with a computer. And so now all of a sudden, human factors becomes HCI, human computer interaction, usability. We're testing individuals. It's everybody who's interacting with computers. And so now all of a sudden usability is more broader, let me say.
That does make sense. So it seems like IBM, again, this is back in the day, you're more focused on making their equipment, their software more usable by the people who were typically using it, which is not the general population.
Before I showed up, but just as I showed up, was there the advent of the PC. And so now we are worried about studying everybody and figuring out who the target audience is. And the target audience is much more diverse for any software product. It was all software stuff.
So you kind of mentioned quickly this idea that what started off as human factors and then changed to usability or user experience or design thinking. All of these things kind of merge. They get put together in ways that they're similar, but they're not the same. Is there one term that's going to 10 years from now we'll look back and go like, well, we just call it X?
So here's the way I understand the history. So at first it was human factors. It can be sneered at by calling it knobology, like knobs and dials. They still needed, of course, the early human factors professionals who were worried about fighter planes in World War II. They still had to certainly understand human perception and cognition, but it was more of a hardware issue. Then, as we talked about, segued into more this PC world where we can't spend a lot of time training people usually. So we have to have more richer usability on any product. Now it's called usability, human computer interaction. User-centered design was in there somewhere. Now UX is user experience is the popular phrase. That I think that's a reasonable adaptive evolution. For me, design thinking kind of makes my teeth hurt. It just makes me wonder, what kind of thinking were we doing before design thinking? And it just feels to me like, I can probably get paid more as the third design thinking consultant than I could as the 2000th UX consultant. And so it feels contrived or something. There's probably some nuance in there that I'm just not getting that some design thinking specialist would tell you, but that's up to you to find him, her, them.
So let's pivot a little bit to data versus gut instinct. So you've got a PhD, so you're smart. I love the gut instinct idea of, hey man, like that should be red because it draws your attention and that's the way it should be and it works for me. When I'm in charge, which is rare, I get to make it red. But from a data perspective, maybe that's wrong. Maybe that's just me that wants to see it red, and that has the opposite effect. Where do we go from, or when did we go from kind of a gut instinct of what user design is to, hey, we've got data? I mean, has that been your career, or has that changed more recently?
It's been my career to convince people not to depend solely on their gut instinct. Now, so there are some really intuitive designers. I'm not one. You may be one. There are some that are really good at this. It is just, in my experience, exceedingly rare that you get it right the first time. And relatedly, you are likely not representative of your target audience. So if you've been working on this product a year or a month or one day, you are no longer representative of the people that are going to stumble upon by your product. And so it's unlikely that your intuitions are going to work. And so that's why I've spent a lifetime trying to convince the world on the value of empirical user experience research, like research in advance to inform the design, and then at the end to validate the design before we ship or go live. And then we ship or go live with confidence that, yeah, I would have rather been red, but oh, guess what? People think red means error. So, that really works better if it's purple or your second favorite color.
That's an excellent point. It's something that I've run into before. I always like to throw the chief of cardiology under the bus, because I've seen it multiple times where, we did user testing. We asked the chief of cardiology, and that's what they said, and that's what we went with. Yet that wasn't your target user, because the chief of cardiology has an army of people around him who do all this stuff for him.
It used to be the case that the software VP, development VP, would read an article in a flight magazine about usability, and they would come to us and say, hey, we're going to ship in 2 weeks. Can you do a usability? Can you do us a usability? And we were so glad that somebody was talking to us. We'd scurry around and we'd run a usability study, and we say, no, you can't ship. Look at all these errors. And they go, too late, we have to ship anyway, but we'll fix that in the next release. Yeah, maybe. That's me being old grunt. The rising tide has raised all ships. The world is getting it. They still haven't totally gotten it, but for the most part, people are realizing that we can't just depend on Craig Joseph's opinion about what color each icon should be before we ship.
So you wrote a book. We haven't talked about your book, Cost Justifying Usability. And it sounds like that's the plea that you're making to these executives that, hey, we'll save you money because you won't have to make it better in the second version. The first version will work if you just give us a little heads up before you ship.
100%. So I didn't write a book. I edited a book. I actually co-edited 2 editions of this book with Deborah Mayhew, Cost Justifying Usability. And here's the point. Going into that, the way the world worked was we'd be sitting around a table, and the director or the vice president in charge of the product would go around the table. And let's say it was a man, just for pronoun ease. And he'd say to the development manager, what's it going to take? And the development manager would say, this many lines of code, this many people months, this many people. And then the testing manager would say, this many machines, we're going to test to this % defect free, this many people, this many person months. The tech pubs manager would say, they're going to be this many online documents, this many hard copy documents, this many helps, this many people person months. And the usability guy would go, well, you ought to make it more usable. Usability is good. It's in all the magazines. And then when challenged, when that VP or director would say, well, how will I know when it's usable enough? Or what if I just take recommendations 1, 6, and 14? Or how much will this cost me? The usability guy would kind of slink out of the room mumbling something about type 1 errors, and we were dead in the water. And so the idea is we can be just as good as that software development manager about projecting how much this is going to cost and what the ROI is going to be. We're going to sell more. The customer support burden is going to be less. Turnover at the customer site. The customers are going to save time. The turnover there is going to be less. So we can make those projections based on historical data also. And so that was just the whole point of those 2 editions of Cost Justifying Usability, is to try to put us on even ground as we stump for the necessarily finite resources.
Let's talk about an example. One that when we were preparing for this podcast, you had mentioned a very excellent experience you had was with OS2. The OS2 extended edition. It was a product that you were involved with. Do I have that correct?
You have that correct, but I'm not so sure people can figure out when you're being sarcastic or not.
I was being sarcastic.
Right.
You did not have a good time, but it's going to become clear.
OS2 Extended Edition, IBM's product, by OS2 Extended Edition. So the developers come to us, we're involved, and they show us the user interface that they developed. And the marketing and sales people have decided that the target audience are people with sysadmin, system administrators, and database administrators with 2 years experience. The user interface looked pretty convoluted to us, but we found people like that to come and test them. They could figure it out pretty well. We made some suggestions, nothing real big. Bada bing, bada boom, it ships. Mom and pop is who are buying this product. There's not a sysadmin for 500 miles. Giant failure because we all had done a bad job of anticipating who the target audience was.
But this was one where you kind of had an idea, even back then, that maybe this wasn't the target audience, but you were not enabled to kind of overrule the people who developed the product.
No, you're giving us too much credit there. We were just trusting them. We were not involved as we should be today early on in identifying. Maybe let's go do some ethnographies and see who's carrying out these tasks today, these tasks that our new product is going to help people with. So no, we were just sitting there waiting for somebody to hand us something, and that's a bad design.
Yeah. So let's dig into that just a little bit. So talk about ethnography. How do I'm telling you, because I'm creating this product, who the target market is. Sometimes I know that. Sometimes I'm wrong, as in this instance. What is a usability expert? How do they determine if I'm right about who my target audience is?
The most common mental model of our discipline is doing some studies of people once we have a product, once we have a prototype or a product before we ship. So do the validation of the design. We should be involved early on doing research to figure out what this design should look like. So first of all, we could just sit here and think, how's this going to work? And we're going to do a bad job of that, just like we would if we decided on the colors without asking anybody. Or we could ask people how they do their job. And, that sounds pretty good. Or better, we could go observe people when they do their job. Because guess what? Those two are going to yield different results. If I ask you, on your PC, Craig, how do you do X? And you go, well, I do A, and then I do B, and then I do C. Well, if I come observe you, you do A, and then you look at that little sticky that's on your screen, and then you do B, and then you go ask Devin down the hall if she knows, and then you do C. Well, we need to know these things. And so going out in the real world and observing people carrying out the tasks that our new product or our new release is designed to help people with is going to give us the richest data, richest info to drive our new designs.
Yeah. So I love that because it's not so much tell me what you do. Let me just watch what you do. You might say, what are you thinking? And I think some people are better than others at describing their thought processes.
Yes. This is probably why we'll do more than one. We'll look at multiple people. Mm-hmm.
I remember reading some article about why some professional athletes who are renowned are horrible coaches. And some are great coaches, but the ones who turn out to be horrible coaches are because the advice they give to the people that are coaching is, well, just hit the ball. So how does one become a user experience expert? I know what you did.
Here's the deal. So I don't want to look like an advanced degree bigot. I am one. I just don't want to look like one. I spent 20 years helping people get advanced degrees, and their employers love them. They do great. Well, I and my age cohort UX professionals did a bad job of making UX a true discipline. So there's no agreed upon curriculum. There's no universally accepted certification. So there are multiple companies that will give you a certification as a UX professional in 10 weeks. I think maybe some do it in 1 week. I believe in my soul that you do not need an advanced degree. You don't need any degree to be a good, even an excellent UX professional. But it takes a while. You can train somebody to do a decent job of carrying out a usability study with 10 subjects, 10 test participants. Don't ask any leading questions, ... Okay, you can do that. But ours is a complex skill set that's needed. How do you decide which method to use when? How do you advocate for your data once you have the data? How do you, as I say, stump for those resources? You can learn all of that. You can get good at all that without a degree. I'm pretty sure you can't get good at all that in 10 weeks.
So yeah, you need some training and tincture of time, experience. It sounds like both of those things.
And so now the challenge is for the hiring manager to be able to discern who's going to be a good one and who's not. So this person comes in, that person's resume looks pretty good, has a certification from this famous place, this famous company, famous group of consultants, probably pretty good. Well, maybe. Now everybody can be a designer. The design tools are out there, so anybody can design anything. We need more and more UX professionals. So that's the flip side of that coin. But I wish we were better at taking more seriously the scientific, empirical nature of UX.
Even when you come out of school, you still kind of need that experience and mentorship.
Absolutely. But when you get your master's degree, I'm going to have helped you do maybe get an internship, certainly do a final project, a capstone project, which is just as good as if a consultant had done it, and connecting you with a real company who has a real need, ...
Yeah. Let's start talking about healthcare. We've talked about designing. We haven't talked about healthcare. You get healthcare. You're a patient. I get healthcare. I'm a patient. Where are some of the big usability problems you see in healthcare in the United States? If there are any, maybe there aren't any. I don't know.
Well, for me, I have a lot of eye issues, and I have a lot of different eye doctors. And there was one office that I would go to, and the last time I was there, I had to sit in 6 different chairs in 4 different rooms, and that was a bad user experience. And so I found another office whose technology was just as good as the other place, but the user experience is 100% better. I go in one room, different people come to me. Every now and then I have to go to another room for some little test, but it's 100 times better. So their poor user experience costs them money. Now they may not care, but I have no idea how many other people are like me in driving them away.
Are there other areas that you've seen, like in terms of billing or inpatient care, or more generic outpatient care, where you've had a bad experience or you've seen someone have something that was so easily correctable, easily fixed, that it kind of made you nuts?
Let's start on the good side. Well, it'll be a good and a bad. So, as we've talked, I have a concierge doctor. My family doc, who has been my doc for over 40 years, changed his practice to be a concierge-based practice 10 or so years ago. I have to spend some of my wife's money every month to send to him for me to stay as his patient. I love this. And here's the joy of it. It makes a phone call okay. So before, if I'm calling my doc, the doc doesn't get any money. The office doesn't. It's costing all them time and energy. They don't want that. But with the concierge doctor, I don't know, once a quarter, maybe twice a year, I'll get something. It's usually imaginary, but I don't know. I'll say, may I have a call from the doctor? And that day he'll call me back and I'll say, I got this. And he'll say, you also got that? I go, no. I go, okay, I'm healed. I mean, and it took 5 minutes. I didn't have to drive downtown. It didn't take him any time. That's a fantastic feature, which I guess can still be true under the traditional method, but it is not always the case. He knows me. He is, given that I always talk to him instead of some clinic of people, that helps. He knows that my, glucose was X 3 years ago.
The idea of a concierge medicine or direct primary care practice where they don't need to generate income with every interaction. Not to say that that's evil in and of itself, but that's the way they keep the practice open, right? They have to have an interaction that gets the money.
Well, let me say, I recognize how lucky I am to be able to afford that. Not everybody, because you still need insurance. You need insurance for the big things. This is extra. So I recognize that I'm lucky.
Have you used any patient portal? Do you look at these things and go, oh man, this is poorly designed?
Yes, maybe 3 or 4 different doctors. Just yesterday, my PT, I went to physical therapy and she put some stuff in my portal. For me, the biggest issue is just remember the damn password. Here's a UX concept. I'm the only one that calls it this. A novice, a new. So I wasn't only a novice the first time I did it. I'm a novice every time I do it. Here's my best example of that. How much do you want to donate to United Way this year? Well, is that amount monthly or annually? Why don't you tell me? I don't know. I got to go search for it. So anyway, so I just wish the portals, all the portals I've used seem to be pretty good. Now, I think on one portal, I said something to the doctor and it appeared in the portal. And I said to him later, hey, whoa, we need to talk about this. I didn't say it exactly that way. And I think perhaps the AI program had made some inference that was wrong. And he may have just said, okie dokie, signed off on it. And it wasn't that bad. My guess is he really did read it and it was okay, but it was a little disconcerting.
Yeah, well, you've just opened up a big can of worms. So one was, it sounds like that doctor was using had an ambient AI scribe.
Yeah, I think that's right.
Okay, so there was a machine recording your interaction, hopefully with your blessing, and then it generated a progress note for the physician, at least, or a part of the progress note, and it might have gotten something a little bit wrong.
I'd bet a lot of money that he did read it and he thought that was fine, and it was fine, and certainly it's with my permission, and I'm glad he's doing it, and it saves him time.
The second thing that you brought up was this concept of open notes. The idea that you're routinely reading the progress notes, the information that your doctor's writing about you, is a design choice. It's a great idea, but it causes a bunch of other things that doctors have to think about that they didn't generally think about before, which is, hey, these patients are reading what I'm writing about them. They always could, but it was a pain. You'd have to go get your medical record and often pay for it and then wait for it. Now it's right there. So it's just another interesting wrinkle.
Well, and it strikes me as only good. It just adds transparency. It helps somebody my age remember. My wife and I doesn't always work. We try to go into either doctor's appointments together because 2 sets of eyes and 2 sets of ears, we do that maybe a third of the time, but we try to do it often because we think it helps. Well, now that portal kind of gives you a chance to hear it again, at least some summary thereof, confirm or deny, or more likely, remember that, oh yeah, I'm supposed to do this exercise or quit eating X.
So let's talk about the other Dr. Bias, the junior Dr. Bias.
My son is a physician, a family doc, and he works for a company that develops this software to help docs. It's AI-based and natural language processing-based software that helps docs do their charting and other stuff. I don't even know. I think it's brilliant. I think it helps the docs spend more time doing what they want to be doing, helping the patient. But the danger, as I said earlier, might be the AI gets so good that the doc just quits even reviewing it, saying, okay, yep, okie dokie.
That's a real concern. Always has been, and will always. I think the risk is always not non-zero that will happen. That definitely is going to happen. Healthcare involves humans on both sides, right? Humans giving the care, humans receiving the care, and there's going to be errors. There will be errors. And to your point about the potential misinterpretation of something you had said or slightly variable thing, if that's the worst that happens, that's terrific. Right. So I think it's always just instead of trying to go and say like, we'll have 0 errors, I think the goal should be we're going to minimize the number of errors and they'll be of minimal importance so that, we're going to be very careful about the important things and we'll try, but have to accept the fact that, there are going to be some things where you're right. I didn't review the note as carefully as I could have, or actually that is how I interpreted what you said. I want to ask you the question that we always ask. It's about design, and it's something you might share with us, something or things that are so well designed that they bring you joy whenever you use them. Is there something in your life that fits that bill?
My whole life, since I was 39, I've driven used convertibles. Not spent a lot, but I love being in a convertible. And my current 12-year-old, 11-year-old Audi convertible, with one button push, I can put the top down, and it is so fast going up or down. I can do it at a stoplight, and it truly brings me joy to be able to, in April in Austin, Texas, to be able to put my top down, because I won't be able to in about a month. It'll be 100 degrees, but that does bring me joy. The usability of the convertible top of my old Audi.
How do other cars do it?
But, there were some where you had to get out and do it manually, and there's some, the top would go down, but then if you want it covered with some sort of cowling or something, you'd have to get that out of the trunk, carry that around. So steady improvement.
That is awesome. Yeah, it sounds like it's easy and it's fast. Well, Dr. Randolph Bias, it was terrific speaking with you. I think there's a lot of stories inside that you're not telling us about that I'm going to try and get from you the next time we talk so that we get the real story. All right. Well, thank you so much. It was really great speaking with you.
Thank you, Craig. This was great for me too. I love thinking about these things. As you can tell, I'm pretty passionate about it. And I'm grateful for people like you and my son who are worried about streamlining healthcare so that I don't have to sit in 6 chairs in 4 rooms every time I go see a doctor.
That is fair enough. All right. Thanks.
Thank you, sir.
Thanks for tuning in. We hope you enjoyed today's episode. For more on Dr. Bias, follow him on LinkedIn at linkedin.com/Randolph-Bias. Check back for more episodes of Designing for Health wherever you listen to podcasts or on NordicGlobal.com. Till next time, we'll see you in network. If you enjoyed this episode, please leave us a 5-star rating and a review. This helps others find the podcast as well.